Ergonomic indications. Provision of substantial risk of child being born with serious mental and physical abnormalities so as to be handicapped in life, structural encephaly, chromosomal Down syndrome, genetic hemophilia abnormalities in fetus likely to be deformed due to action of teratogenic drugs or radiation exposure in early pregnancy, rubella and viral infections in first trimester. Place for conducting MTP. A hospital established or maintained by government. A place approved for the purpose of this act by district level committee constituted by the government. MTP Act Amendment 2002. MTP Amendment Act was passed in 2002. Term lunatic was replaced by mentally ill. MTP place to be approved by district level committee chaired by CMO DHO. Defaulters rigorous punishment for 2 to 7 years. Owner of the place also responsible if defaulted. Medical abortion. Mifepristone RU486 misoprostol approved for up to 7 weeks terminations. Only an RMP as defined by the MTP Act can prescribe the drugs. Who can perform MTP? A medical practitioner RMP who has a recognized medical qualifications whose name has been entered in state medical registered and who has such experience or training in gynecology and obstetrics as described by the rules made under that. MTP rules training requirement. For termination up to 12 weeks, a practitioner who has assisted a registered medical practitioner in performing 25 cases of MTP, of which at least 5 were performed independently in a hospital established or maintained or a training institute approved for this purpose by the government. Rules of MTP. Practitioner who holds a postgraduate for termination up to 20 weeks, first of all. Now, second one is practitioner who holds a postgraduate degree or diploma in obstetric and gynecology. A practitioner who has at least 1 year experience in practice of obstetrics and gynecology at a hospital which has all facilities. Regulatory body DLC, district level MTP committee, composition of the committee, district level of MTP committee minimum of 3 and maximum of 5 members including chairperson CMHO, composition of the committee, one medical person gynae surgeon, anesthetics, one member from local medical professional NGO and Panchayati Raj institution of the district. At least one member shall be of approval process. Application in the Form A to be addressed to CMHO by place seeking approval. CMHO verifies or inspects the place to satisfy that termination can be done under safe and hygienic conditions. CMHO recommends approval to the committee. Committee considers application and recommendation and approve and issue certificate of approval in Form B.